DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. We're going to have a great show today, and I'm glad you joined us. My guest is going to be Dr. Matt Miesner, and today we're going to talk about what a water belly is in cattle or in steers, and how we can treat it, how we can prevent it, different things you need to look for. I'm glad you joined us. It's going to be a great show. Got more hats. See you after the message.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey there, welcome to DocTalk. Dr. Miesner, welcome back.
Glad to be here, as always.
Folks, this is a friend and colleague, Dr. Matt Miesner. He is great, and it's just awesome to have him here on the show. He's Associate Clinical Professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. And today we're going to talk about water bellies and or plugged up steers, goats, whatever, but something that you've had quite a bit of experience with.
A lot of it, yeah. I mean, it's common in just about any species that we work with. I've had to deal with it from cats and dogs early on in my career, from white-tailed deer to bulls here later on with just the large animal stuff. So about anything. People. And I haven't had to do one of those.
No, me neither.
Thank goodness. I have had an intern that was passing a stone once, and she looked really painful. So.
It does not look. It does not look like it's.
I don't want to go there.
All right.
Yeah.
So tell me, just kind of walk me through what is causing this. What do we see in these animals?
I think the absolute most common reason that they would be a water belly, or essentially the technical term would be a urethral obstruction or a urinary obstruction, and the most common reason is a stone or a calculi that forms in the urinary tract, makes a concretion, it gets so far and then just shuts down, and so then unable to urinate, it starts backing up, and so that's the most common. I have seen injuries do it. Some worry about preputial or penile injuries in bulls, preventing them from urinating, which could back them up. However, I've not seen that yet. That's a different thing. So injuries, but by far and away, the most common reason would be a stone.
Well, I think a lot of people don't understand there's a solid fraction to urine.
Right.
And you can freeze dry urine and wind up with a solid fraction with calcium and oxalate and nitrogen, urea nitrogen type compounds. And these things then, I guess, just start to form into a ball, and then we get a plug. They
do, yeah. I mean, we've seen on an ultrasound, you can see these little refractile things, and in urine, and so yeah, you have solids in that eventually can congeal.
When you go to some of those truck stops, and you look in the bathroom there, you learn pretty quick that scaling in some of the things there is a solid fraction to this problem.
Yep.
But so when we start to think about these animals and the way they present, obviously they're going to start out in some pain, I would assume.
Sure. Ruminants in general, they'll mask it pretty good, but straining, usually sometimes they're just off by themselves and not feeling well, and then it progresses from there. But you see them, sort of a humped back. And one thing that I like to say is that ruminants especially are recreational urinators and defecators, as one of my mentors told me that. And so there should always be a moist prepuce, or should always be urine coming, whether that's a goat or a steer, So you see that, we start looking for those and see if they're dry.
Gotcha. Well, we're going to take a break. When we come back, we'll start talking a little bit more about some of the specifics with urinary calculi or water bellies, different ways they can present, different things that you can see. Dr. Dan with Dr. Matt Miesner. More after these messages.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Hey folks, Dr. Dan from DocTalk here. Be sure to join me for Drovers Cowboy College, June 20th and 21st in Springfield, Missouri. We're going to have experts covering topics such as cow nutrition, treatment options, low-stress cattle handling, genetic selection, and economics on keeping your cow profitable. Be sure to register. Go to www.droverscowboycollege.com or give us a call at 877-482-7203, and I'll see you in Springfield.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
This Medford, New Jersey school bus runs on biodiesel, and so do these. In fact, all of these buses run on clean-burning biodiesel, which is great because the more we use biodiesel in our heavy-duty vehicles, the less carbon pollution in our air. Think how great it would be if more of our school buses ran on biodiesel. More biodiesel, less carbon pollution. More is less. Biodiesel, America's advanced biofuel.
This segment brought to you by the new hired hand portable cow sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Matt Miesner, who's an associate clinical professor and leads the section of livestock practices here at Kansas State University's Veterinary Health Center. We're talking about water bellies, urinary calculi, these cattle plugging up. But can you kind of walk us through, some of the differences in what we're going to see with some of the anatomical differences and why this happens?
Yeah, so interesting. We can see stones in anywhere from the kidney to the outside. The most common places are places where that would narrow for these stones to stop. So we've seen ruptures in the ureter, we've seen bladders that plop. But in cattle, there's a narrowing right about we call it the sigmoid portion of the penis, and it's a narrow area. There's some muscles that attach there, and it'll get about that far, and then it tends to be a narrow spot and it stops. Okay. The small ruminants, they also have an extra little appendage that comes off the end of their penis, and they'll plug there. Cattle don't have that. However, they'll oftentimes plug right about where we call that S-curve portion of the penis, and that's just a narrowed area. And
and so when they do, then do we see different clinical signs or different presentations based on where the plug occurs?
It can. So one of the first physical things we mentioned, first it should be moist if we have a dry prepuce or sheath. Next thing I do is I come up and I can palpate that area, which is generally right above where the scrotum would have been or where it is in a bull. And you can feel that area, and they're oftentimes painful. Sometimes there's some swelling and some leakage there. Occasionally that will rupture there. And then you'll have urine that accumulates underneath the skin all the way down the sheath. So we'll see that. But sometimes it actually ruptures in the bladder, and they start getting a full abdomen full of urine. So they're still painful. They're still not urinating. They're still usually off feed and not feeling very, very well. But that pain right around that sigmoid area sometimes gives us a good idea.
Okay. Now, I've seen different presentations of the water belly, and sometimes there'll be, the urethra will be filled up. You can get the urine in the belly, in the sloshing sound. Sometimes we don't see anything externally. We just see that animal that's not doing well, tail raised, and they're straining. What are some of the differences? I think there's some confusion as to what a water belly is and what we're seeing.
Sure, and I think that producers or others that have seen water bellies, and they've seen the one where they rupture and all the urine just accumulates underneath the skin and around the sheath.
Yep.
It's visual, you can see it, versus another one that's bladder popped and it's now leaking urine into the abdomen. It doesn't get underneath the skin, and so that can just be a full abdomen full of urine. And ruminants are unbelievable about recycling all this urea and this toxin, so it may just be an ADR not feeling well. They urinated, popped into their bladder, and they felt really good, but about 36, 48 hours later, they're starting to get that built back up, and they start feeling pretty sick. So it's easy to miss them. It can be a short period before the urine releases.
Yeah, and I've seen them not feeling good, and all of a sudden that bladder ruptures, and then they feel relieved.
Yep. Mm-hmm.
And whether they rupture in the urethra or anywhere in that tract, if it's going in the abdomen, we may not see
it.
All right.
No.
Well, we're going to take a break. When we come back, we're going to talk a little bit about how we treat these animals and how we can prevent them. You're watching Doc Talk. Dr. Dan here with Dr. Matt Miesner. More after these messages.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Hey folks, Dr. Dan from DocTalk here. Be sure to join me for Drovers Cowboy College, June 20th and 21st in Springfield, Missouri. We're going to have experts covering topics such as cow nutrition, treatment options, low-stress cattle handling, genetic selection, and economics on keeping your cow profitable. Be sure to register. Go to www.droverscowboycollege.com or give us a call at 877-482-7203, and I'll see you in Springfield.
It takes vision, dedication, hard work. It takes knowing who you can trust. At Zinpro Corporation, we have more industry-endorsed research behind our trace minerals than any other company. Proof that our patented performance minerals help improve overall animal health and performance. Lots of companies make claims. At Zinpro, we generate results.
If my calves start healthy and stay healthy, I've got a good shot at making money. That is why I trust Clostrix. It gives my calves the protection they need until their own immune systems kick in.
Calf raisers trust Colostrix colostrum supplements. Colostrix is USDA licensed and proven effective. When your money is on the line, trust Colostrix.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Matt Miesner. We're at Kansas State University's College of Veterinary Medicine, where Dr. Miesner is the section head for livestock practices here at the Veterinary Health Center. And I just wanted to mention too, we got 2 more hats in. Thanks for sending them. We got one here from Cactus Feeders down in Amarillo, Texas, and then one from Vinmar Angus, which is Gordon, Nebraska. And actually, that's my cousin, Vince Bickle, and his wife, Mary, and Ryan and Bryson. And so thanks for sending the hats.
Good hat.
And, yeah, we keep it rolling. But Dr. Matt, when we're talking about water bellies, so we've got them plugged up, and now I bring one in. What are some things you're going to do or assess and then do to treat these types of animals?
Well, one unique thing in ruminants, whether it be sheep, goats, llamas, alpacas, pigs, or cattle, others we just got to try to open it back up, right? So we just got to get urine flowing again. It's easier said than done. In that ruminants, they have this sort of blind pouch. You think, well, let's just pass a catheter up there and break it free and loosen it up and get it into the bladder and get it free. There's a little blind pouch up there that doesn't allow us to do that very easily. You have to require some special work. But you've got to get the urine out. And so in steers, by far and away, oftentimes we're just going to reroute them, where we do a surgery where we redirect the penis out the back end or open the urethra to the back end. Some will be able to dissect down and find the stone and break it. Whatever we got to do, we got to get rid of that obstruction, and either that's a redirection or whatnot. In small ruminants, we'll sit them up on their back and we'll look at that little appendage, and sometimes there's a stone in that, But in cattle, we just got to get it free and open it back up. If the bladder's ruptured, oftentimes if we can get it to urinate normally, that bladder can heal on its own.
Yeah, and I used to, the cells of the bladder are like, leaves, and that thing, when it opens up, the bladder ruptures, it can actually go back together and heal pretty well if we can get that moving. And like you said, those cattle are pretty impressive in how long they can withstand having urine leak from the bladder into the abdominal cavity.
Right. Yeah, and we were just kind of talking during the break that there's some research out there so they can go a couple of weeks with that, and not get sick.
Pretty tough.
But, and that's not an option really in a bull, so we do have to redirect it another way, and we do these surgeries where we put a tube in their bladder, allow that to drain to the outside while we're trying to let the urethra heal, so we don't really want to cut that if we've got a bull that needs to breed later on, or a buck or a ram.
And y'all see bulls all the time.
Yeah.
I mean, and pretty consistently in here in your service. What are some of the things, I guess we got a minute here before we go to break, but maybe some of the things that people that are wondering about, working with their veterinarian to send a bull down to you, what are some of the things that y'all are doing here?
Right. I mean, we work them up from the get-go, and we get a good history and discussion with your veterinarian over the phone. I talk to them on the phone. We all kind of make a plan together, and we start from square one. Say, where do we want to go? What are our values? What's our options on this? And we can do some specialized surgeries as far as these tube cystostomies and just getting dissecting down to your urethra and trying to find the stone and getting it out. Trying to do some of those, but we usually work from square one with your clients, the client and their veterinarian together, and try to everybody come up with a plan that meets all of our goals at once. So we don't always do the specialized things. We can redirect them just as well. So we just modify it for each and everybody.
Awesome. Well, folks, if I had a bull that needed surgery or was lame, and my local veterinarian didn't have the equipment, this is really a place where you can send animals. Dr. Miesner's one of the world's best, and anything I had with one of my animals, this would be the person I'd be sending them to. Folks, we're going to take a break. When we come back, more with Dr. Matt Miesner here from the Veterinary Health Center at Kansas State University.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
My family owns and operates Empire Dairy here in Wiggins, Colorado. My father-in-law, Jack Denige, he came here from Portugal, and he has a long history of milking cows in his family, and they started milking in the United States in 1989. My husband Norm and my brother-in-law Bill, a partner in the dairy. And you don't normally think about maybe the beef checkoff when you're a dairy producer, but there's certainly a lot that the checkoff does for dairy producers. We're about 20% of the beef supply. So beef quality assurance has helped dairy producers by giving us some new tools and some new perspectives about things that we do on the dairy and how that translates into a beef carcass at the end of their life cycle. So some things that we talk about are injection site, loading and handling procedures to minimize bruising and we want to keep that animal in the best condition possible, not only for the health and welfare of the cow, but at the end of its production cycle, we want to produce a quality product that we can enter into the beef supply. At the end of the day, the more successful operation you can have, the better chance you give your kids to be able to carry on and continue in this industry. Norm and I have 3 kids that we hope someday will want to come back and take care of these cows and take care of this land.
Still using ineffective fly tags on your cattle? It's time to eliminate fleas, ticks, flies, lice, and parasites, and at the same time, give them a shiny coat, making them more valuable. One fly tag can cost $2.50, but you can do this all for about a nickel a head. Introducing the Cow Sprayer, designed and built in the U.S. The Cow Sprayer is portable, solar-powered, and comes with a 25 or 40-gallon tank. Eliminate parasites for about 5 cents a head with the Cow Sprayer. Cowsprayer.com.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, Dr. Dan from DocTalk here. Thanks for joining us. I'm here with Dr. Matt Miesner. He's a colleague here at Kansas State University where he leads our livestock practices section and sees a ton of cases in a referral setting at our veterinary health center at Kansas State University's College of Veterinary Medicine. And while we talked about the clinical signs, we've talked about the treatments, the surgeries, and other options, really prevention is something we need to focus on.
Yeah. And we said it's stones almost always, and it's dietary, so they form these and those minerals or solids just get out of balance, and that's what forms a stone. And we know high-risk diets. We know what tends to increase the chances of a stone forming, and you can look at those, you can predict when there's going to be a problem, and you kind of look back at it as far as a preventive. And sometimes, we put bits into a ration that kind of limits some of the pH, that will change some of those electrolytes that get exteriorized. But there's just going to be a certain number that are just going to tend to form stones. So when we see a higher number than we expect, then we start really worrying about or looking into the diet. But sometimes it's just an individual or two, and just like people, you might have one person in your family tree that's had a stone, and we see a certain number of other species where there's a really small percentage that just make stones. That's just the way that they metabolize things.
Yep. And I always say, if you're using those 12 mineral blocks, 12% calcium, 12% phosphorus, 12% salt, you get that calcium to phosphorus ratio out of whack. You need to have it at least 1-to-1 or 2-to-1 in that calcium to phosphorus ratio. You can go all the way up to 7-to-1, but no more than that. But at least 1-to-1, 2-to-1 calcium to phosphorus to prevent stones. Some of the grazing things with the silicates and things, there's not a big way to prevent those, but just understand making sure that you have adequate water supply for those animals is really important.
Sure, dilution and swings in weather. Yeah, we do see spikes, it seems like, at certain times of the year where water consumption might be down or up, or change in balances like that. And so absolutely keeping it down. Some of these feeds for small ruminants, they do have some additives to help acidify the urine if it's the type of stone that forms in alkaline urine. But not all stones form in that same pH. You're right. We didn't talk about, heck, there's half a dozen different types of stones that can form, and they're all a little bit unique in how they make it.
And I think it's important that if you start to have an outbreak, make sure you get with your veterinarian right off the bat, get a diagnosis, because it's important to find out what kind of stone it is, because you can't really treat or prevent without getting that diagnosis to make sure.
Sure. Yeah, there are some that really don't form in necessarily grain diets, and maybe that's just an individual that has a different type of metabolism.
Yep.
So,
well, thanks for being on the show.
Oh, I love it.
Yeah, well, we love having you here. Folks, thanks for joining us today on DocTalk. Remember, always work with your local veterinarian. If you want to know more about what we do here on DocTalk, you can find us at www.doctalktv. Always work with your local veterinarian. I'm Dr. Dan Thomson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.